My name is Brittany Carpenter. The date is March 10th of 2018, and the mineral I chose to research and present is fluoride. One of the main roles of fluoride in the body is how it prevents dental caries by building enamel around teeth, and a small amount of it helps in the development of teeth. Fluoride is also essential for the mineralization of bones and the formation of dental enamel. 96% of fluoride in the body is found within the bones, and fluorine works with calcium to make up the bones. Lastly, fluoride also aids in the protection of the spleen by protecting the organ against viruses and bacteria. The regulated daily amounts for fluid intakes among children, adults, and pregnant women are listed in this table. The first amount represents the adequate intake number, while the second number represents the upper limit amount. As you can see, those aged 7 to 12 months must intake 0.5 to 1.8 milligrams per day, etc. In the table to the right, I have included the amounts of fluoride that would indicate a deficiency in certain individuals. Consuming fluoride levels lower than what is listed can lead to the decay of teeth, curvature of the spine, weak eyesight, and susceptibility to infection. Too much fluoride can also be harmful and lead to dental fluorosis. I've listed the amounts that individuals should not exceed in order to maintain optimal quality health when considering fluoride levels in the body. Signs and symptoms that could indicate a toxic level of fluoride would be fluorosis or skeletal fluorosis. Fluorosis includes pitting or discoloration of teeth, while skeletal fluorosis includes weak or malformed bones. Food sources that have fluoride in them include fluoridated drinking water, tea, seafood, green leafy vegetables, and nuts. And I will mention a few others on the next slide. Some supplements that can be taken to reach an optimal fluoride level are specific toothpastes, oral rinses, and gels. Here are some different types of nutrient sources that can be used to maintain a good level in the body, and this includes avocado, radishes, lettuce, peaches, strawberries, apple, carrots, 1% milk, 2% milk, and skim milk. Listed here are some new interesting facts about fluoride. The first one I have included is that most developed countries do not fluoridate their water. America is one of the only developed countries that does fluoridate their water. Fluoride affects many tissues in the body besides the teeth, although many people only think it has to do with the teeth. It actually has to do with many other parts of the body. 40% of American teenagers show visible signs of fluoride overexposure, which can be shown through their teeth, if there are white strips on them. For infants, fluoridated water provides no benefits, only risks. And here we have my references in APA format. Thank you for listening.